Good afternoon. As a regular reminder, if you want to ask questions, make sure you're sending video and audio out so I can hear you. And I know you've all been asking me for a couple of days, so I'm pleased to tell you that the Secretary General will be with us virtually and hold a press briefing tomorrow starting at noon. He will discuss the impact of the COVID-19 pandemic, his call for a global ceasefire, and many other related topics. And that his briefing will, of course, replace my noonish regular press briefing. In the Security Council, Geir Pedersen, the Secretary General's Special Envoy for Syria, told Council members that he strongly believes that Syria needs a ceasefire arrangement that results in sustained calm and is nationwide in scope. Briefing members by video conference, he said, "We cannot afford hostilities which should surely lead to another surge in displaced vulnerable communities. We could not afford this scenario before the pandemic," he said, "and the price could only be higher now." Mr. Pedersen welcomed the fact that there has been significant calm in many areas of Syria, especially relative to the apexes of violence of previous years. He said, "We have not witnessed an all-out offensives nor further displacement since early March." But he added this is an uneasy and fragile calm in both northwest and northeast Syria, noting that just yesterday, a bomb in a market in Afrin reportedly killed more than 40 people. And our colleagues in their working for the UN system in Syria strongly condemned that attack. Mr. Pedersen's remarks were shared with you earlier today. This afternoon, Mark Lowcock, the Emergency Relief Coordinator, will be briefing Security Council members by video conference on the humanitarian situation in the country. That briefing is scheduled for 3 p.m. And again, we will be sharing his remarks with you. Staying in the Middle East, turning to Yemen, we have seen reports this morning from the government of Yemen confirming 5 additional COVID-19 cases in the country. We remain deeply concerned at the potential of the virus to quickly overwhelm Yemen's already overstretched health system. Epidemiologists have warned that the disease could spread faster, more widely, and with deadlier consequences than in many other countries. The UN and our frontline partners continue to provide guidance and coordinate with support and support health authorities to suppress transmission. They prepare and equip COVID-19 specific hospitals and isolation units, have secured supplies, identified and treat people with the virus, and inform the public about the virus and how communities can best protect themselves. For its part, the International Labour Organization warned today that the continued sharp decline in working hours due to the pandemic means that 1.6 billion workers in the informal economy are at the risk of losing their livelihoods. This represents nearly half of the global workforce. Worldwide, more than 436 million enterprises face high risk of serious disruption. These companies are operating in the hardest hit economic sectors, including wholesale and retail, manufacturing, accommodation and food services, as well as real estate and other business activities. And the World Food Programme and the UN Children's Fund are urging governments to prevent devastating nutrition and health consequences for the 370 million children missing out on school meals as a result of school closures. For millions of children around the world, the meal they get at school is the only food they would get in a day. World Food Programme and UNICEF are working with governments to support children who are out of school during this crisis. In 68 countries, governments and WFP are providing children with take-home rations, vouchers, or cash transfers as an alternative to school meals. The two organizations are also calling for support as they set up to assist governments in the coming months to ensure that when schools reopen, school meals and other health and nutrition programs resume. And from Southeast Asia, our friends at UNICEF today warned that the region could face yet another health emergency if children do not receive their life-saving vaccine shots. Nearly a quarter of the world's immunized or partially immunized children live in South Asia, where nearly all of them in India, Pakistan, and Afghanistan. Also, Pakistan and Afghanistan are the last two polio-endemic countries in the world. Lockdowns due to this pandemic have severely disrupted routine immunization, But UNICEF says as long as frontline health workers take appropriate precautions, particularly washing their hands, there is no reason not to vaccinate. In fact, it is crucial that vaccination programs continue. And a few country examples to share with you from Mauritania, where there are 7 COVID-19 cases. The resident coordinator for the United Nations, Anthony Ohemeng Bohama, and the UN team are supporting the government's response plan and also working on funding. In the health sector, the World Health Organization has helped to strengthen local lab testing capacity, as well as provide ambulances and set up treatment units in the capital. For its part, UNICEF provided sanitizing equipment, trained doctors on infection prevention and case management, while the International Organization for Migration helped set up isolation zones and trained border agents on COVID-19 control procedures. The UN has also worked to set up a dedicated COVID-19 call center, which has processed more than 200,000 calls within the first week alone. The team produced a communication material in the 4 national languages and worked with local religious leaders to disseminate information across a network of 5,000 mosques. And in Nepal, the number of cases now stand at 52. As of yesterday, the UN country team is setting up a multi-partner trust fund for areas including health, logistics, water, sanitation, nutrition, coordination, protection, and communications. We, along with the support of the Red Cross and other partners, have assessed 900 quarantine sites in Nepal alone to ensure proper health, hygiene, and other safety standards. The UN team is also supporting governments' communications efforts to contain the spread of the virus, with 22 national TV channels and more than 500 radio stations across the country disseminating that message in multiple languages and reaching out to more than 15 million people. And in Cyprus, the UN peacekeeping mission there yesterday facilitated the delivery of critical medicine and oxygen cylinders to patients from the Maronite community living in the north of the island. All trucks and goods were disinfected at the delivery points. The number of personnel required was minimized, and physical contact with the elderly beneficiaries was avoided as part of the mission's effort to prevent the potential spread of the virus and to continue humanitarian operations at the same time. Our peacekeepers there also assisted 3 Turkish Cypriot cancer patients to cross the buffer zone for critical oncology treatment in the south of the island. And the head of the UN peacekeeping mission in the Democratic Republic of the Congo, Leila Zerugi, said today she is concerned by a spike in attacks by local and foreign armed groups in the country's east. In addition to supporting the pandemic response in the country, she said the mission is committed to continuing its work to protect civilians. In the provinces of Ituri, South and North Kivu, peacekeepers continue to support the Congolese armed forces through a wide range of actions. They have increased patrols in the most vulnerable areas, including camps for displaced people. They're also providing logistical support to the National Army, notably by facilitating deployment of troop reinforcements, the transport of equipment, and medical evacuations. They're also doing reconnaissance flights to help Congolese troops locate armed combatants. In addition to this, the UN mission continues to document human rights violations. The special representative reiterated the need to continue stabilization efforts in the country through a comprehensive approach. She called for unity as she denounced those who stir up communities at the expense of the most vulnerable. And in neighboring Central African Republic, the UN peacekeeping mission there reports of heavy shooting in the town of Ndele resumed this morning. The incident resulted in the displacement of a large number of people who had gathered around the UN peacekeeping compound for protection. Peacekeepers immediately dispatched a quick reaction force to the town to protect the civilians. The UN mission has also increased its patrolling activities in Bangi's 3rd district, the neighborhood also known as PK5, after a dispute Monday between 2 armed civilians triggered gunfire and the use of grenade, as well as 2 incidents of armed robbery. This resulted in 5 people killed and another 11 injured. As of yesterday, the situation was calm and the mission continued to patrol the area. And an update from Niger, where as of yesterday, 709 cases of the virus had been reported, and that includes, unfortunately, 31 deaths. To support the pandemic response, The UN team in the country has donated medical materials, drugs, and equipment to the government. The donations include surgical masks, protective glasses, gloves, protective suits, transparent plastic face protection screens, thermometers, and tents. It also included oxygen concentrators, a neonatal resuscitation table, and ultrasound scanners to support prenatal and postnatal care for mothers and babies. So far, the UN Niger has contributed $22 million to the government preparedness and response plan, budgeted at $990 million. And last but not least, I'm very happy to thank our friends in Tirana for their full payment to the UN's regular budget. Albania's payment takes us to 87 fully paid up member states. That is it for me in terms of talking. I will now talk in answering of your question. If you allow me to take my glasses and look at the questions that we get from Florencia. Florencia, I'm not seeing anything as of yet, but she is typing. All right, 1 second. No doubt you're saving all your questions for the Secretary General tomorrow. All right, James Bays. I can always rely on you. James? I can't hear you, so I'll wait a little bit. Can we try to unmute James's mic? All right, maybe you can type in your question since I can't seem to hear you.
Oh, hear me now? No.
Ah, there we go. Perfect.
It's weird.
All right.
Oh, you do? Okay.
I can hear you. I can't hear you.
Okay. Sorry,
it
was a question about a story that I've been working on, which was plans for resurrected plans from the Stockholm Agreement of a mass prisoner exchange in Yemen, the ICRC confirming that all the arrangements now are in place. And I wonder more you can tell about that and the Secretary General's hopes for that.
Well, this is obviously one of the things Mr. Griffiths has been working towards. As with all things with Yemen, we'll be ready to announce something when things happen. But this is something we would very much look forward to. Abdelhamid.
Thank you, Stephane. I just want to follow up with my previous questions. I asked you 2 questions about Saudi Arabia, a letter to the Secretary General of the Arab League, and if there is any statement on what Haftar did in Libya. Statement from the Secretary General.
On Mr. Haftar, I think I was pretty clear yesterday. I think we stand against any unilateral measures that would put in jeopardize the political process, and that would go against what are the political institutions that have been agreed to through the political process and reaffirmed by the Security Council. On the letter to the Arab League, I plead guilty because I forgot to check. But let me see what I can what I can do. Mr. Abadi asked, does the Secretary General think that COVID-19 is a threat to international peace and security?
And the situation in Saudi Arabia, I ask you.
Saudi Arabia, I don't have any.
The human rights activist who was.
But let me see what
Abdullah Hamid.
Yeah.
Thank you.
Let me see what I can get on that. So the question from Mr. Abadi, does the Secretary General think that COVID-19 is a threat to international peace and security? The question, is he triggering Article 99? No, he has not written a letter formally triggering Article 99. However, I think I would refer you to his very strong and direct statement to the Security Council when he addressed that August body, I think last week or the week before, as the days start to merge together. Okay, any more questions? Florencia, anything more? Let's see, she's typing. Nope. Okay, well, listen, we will see you tomorrow. Edie, just under the wire before the no objection goes into effect.
Right.
Go ahead, Edie.
Just two quick questions. A follow-up on the Secretary General being here tomorrow. I assume he's going to take questions for more than 5 minutes, so a number of us will get to ask. I'm sure other people are interested in that.
That is my aim, Edie. I don't want to suffer your wrath. Nor do I want to suffer his wrath for that matter. So as usual, I'm in the middle. But yes, we will make it last a bit longer than the last one. And your second question.
Yeah, my second question was whether there is anything new on Libya.
Nothing new.
What's happening there, and what Ms. Williams is doing?
Nothing more than what I've reported. Ms. Williams continues her contacts on the ground. All right. We will see you. We will see you tomorrow. We will go use the same process we've been using this time. Florencia will be in the room with you to help out if needed. But we will be using the virtual press conference room we used for the Deputy Secretary General, so it'll look a bit nicer. And we will circulate the SG's opening remarks tomorrow morning for you under embargo. All right. Take care and have a great day. Bye.